Yeah, good morning, students. I'm your subject teacher for the subject Pharmacognosy, as well class teacher also. Welcome to this new academic. It's my first lecture. Before going into my first chapter, that is called as History of Pharmacognosy, it's my responsibility to express or to convey the points which is kept by the university in your syllabus. And you all must aware what could be the scope and objectives of this subject in your Pharm D program. This subject has been introduced for the pharmacy course in order to make the student aware of medicinal uses of various naturally occurring drugs and its history, sources, distribution, method of cultivation, active constituents, medicinal uses, identification test, preservation methods, substitutes, and adulterants. Some of the words you might have been familiar, and your question is why this subject in Pharm D program? It may be a non-core subject, but this kind of knowledge also really and equally required when you go and practice as a pharmacy in future. I'll take in this place. You are going to study about sources of drug. The sources of drugs of naturally obtaining substances are not only by the medicinal plants, which also includes from the marine sources, microbiological sources, mineral sources. As you know, all a simple example, a shark liver oil capsules are there in the market. The source is from shark fish, and the liver organ being processed and refined, and it comes in the form of soft gelatin capsules for the patients. And the method of cultivation. So I'm not going to do any farming, and why the method of cultivation concept. Cultivate method of cultivation is involved a very big process. It's all happening in the farmland. Sometimes it can be cultivated widely, which is there in the forest regions. I'll take an example in this way. If the farmers use more of pesticides in the soil during the promotion or during the cultivation, if they add synthetic manures or synthetic pesticides in more in amount, what happens to the soil? It will absorb, and the plant which we grow there, it will sucks those pesticides in excess amount through the root nodules and pass to the entire medicinal plants, right? And those medicinal plants being cut and supplied to the industry, and they do involve with certain process for making the material in a powder form or maybe in the form of extracts that comes in the capsule. If the QC department is taken it lightly when they're passing the product into the market, the residual pesticides amount in the product will be excess. Because being is obtaining from the natural origin, it is not possible 100% free from pesticides product. There are certain permissible limits specified by the regulatory authority. There are some monographs are there. There are some pharmacopoeias are there. One need to compliance with those pharmacopoeias before launching the product into the market. But my saying is, even though if it is come into existing into the pharmacy shelf, there your place come. Company A producing the same two or three extracts combined formulation in the form of capsule, B also producing same, and C also producing same. But the patients who received a C company product for the same indications, purpose it's been prescribed, and some kind of toxicity reactions or some types of adverse reactions or some type of uh, organ uh, organ what we call organ damages. So you can think up to that level, maybe some kind of pesticides contaminations, and maybe sometime they processed for during the after collection before storage, or during the time of storage they take the material for the what we call sterilization. There are so many sterilization agents being added, that contaminations, or maybe some of the heavy metals, because it's naturally growing material, right? Some heavy metals residuals amount might be higher, like arsenic, lead, mercury. So you can suspect any of that perspective also. It is not necessarily you may get this kind of chances every time. So I'm just trying to correlate why the cultivation, collection, and storage practice knowledge is required for you. And second thing, there is a word in the objective they introduced for your course, active constituents. If somebody asks you about this capsule, maybe 10 different plant extracts might be there. It's not like a paracetamol or aspirin, a single entity product. It is a combination of so many. And the patient may be eager, or you may be eager of yourself, what could be the constituents present. So if you have some basic knowledge, okay, these are some plants and there may be a chances of those constituents. And those constituents possessed medicinal property, it has been proved scientifically, and it has been coined in the monogram, means regulatory books, and you can express to your patients also. I'm not meaning here that you'll get all 600, 700 plants which is revolving in many products in India. You'll be gaining the knowledge, but you will come to know basics about, okay, some plant have certain secondary constituents like alkaloids. Some plant materials might have the secondary constituents like glycosides. Something might be having a tannins. So these all words what I said, they are the major class or major group of chemical constituents present in the medicinal plants. And you're supposed to know some identification test. And if you suspect if it is not in that group, and you can send to the laboratory and you can check if you are in the clinical research, or if you are in the drug discovery process, if you are in somewhere in the quality assurance department, when you placed yourself, and this kind of testing knowledges are really required. And because it is not from a single source, all the plant materials are coming from the diversified way from nook and corner of India as a supplied material from the supplier. There may be chances of a competition. There may be chances of not availability of the authentic drug, I mean the genuine drug. They may substitute with some other drug which is looking similarly morphologically. Sometimes some substitute may have a lesser content of the active principles which is existing or aligned with the genuine drug. And sometimes people do intentionally adulteration, completely non-relevant material in order to bulk their supply. That is only the motive for the making a profit of that. So this will give you the entire picture. So that could be a scope and objectives of studying this subject in your program. There are so many reference books being specified in your syllabus. Pharmacognosy by Brady and Taylor. It's a wonderful book. I think you required only 10% of the materials for your program. And there is a book called as T.E. Valleys. This is of only for the practical purpose. You are going to do some practicals after this COVID time. If you are coming to college, obviously we'll be conducting some practicals based upon the herbal material. You'll be doing the microscopic evaluation. There you will see all the internal characters of those plant material. And that time for the interpreting the characters, you may require this book. And there are so many books has been specified. And my prescribing textbook for this year for my subject, Pharmacognosy and Phytopharmaceuticals, written by the author Dr. T. Sham. It is exclusively for the second year Pharm D program. But the material will not fulfill the entire syllabus. But according to my knowledge of last 3 years I'm handling this subject, almost 92 percentage of your syllabus being covered, and that serves your purpose for clearing the exam as well as to get a good score. And something might be missing in that book that I'll be issuing parallelly or in later stage as a supporting note materials for the weaker student. And the phone number has been specified, as well as the cost is almost closer to 300. It is available through Amazon as well as from the Flipkart, or you can contact the publisher straight away. Within a couple of days or maybe a week time, you may receive this book. So it will be easy for you once we complete our explanation to this audio presentation. You can parallelly go through the chapters in that book, so you'll get some more clear concept. And still, if you want to widen your knowledge, you can refer those standard reference books. Those standard reference books you can download as an e-book free of cost, and if possible I try to upload the link or maybe a downloaded e-books in our Google Classroom. And syllabus is very simple. It's not like the other subject. Very 15 unit concisely given. Somewhere they are not explained up to what extent to prepare and what extent to teach. And as per my experience and the repeated questions, on that basis I'm limited some of the portions in that particular unit or in the particular topic. And the entire 15 chapters will be shared among us, I mean myself and Linz Mary Joy. She is a supportive teacher for your class for this subject. And out of 4 lectures, I think I may take 3 and she may take 1. And days may shuffle. You don't need to panic on that. And both will be sharing through same Google Classroom or maybe in the different Google Classroom. You just check as per the time your class is there or not. If it is not in mine, it may be under Linz Madam. So let me give a brief about the syllabus, and that will gives you the fresh up of the subject. Introduction, that what is pharmacognosy, and how it comes, who coined this name, that may be the question, and what is herbal drugs, what is ethnobotany, what is ethnomedicine, what is natural product, what is phytocompound. These all are very similarly looking words. So that and all I will be that and all I will clarify you. And of course, you're supposed to know the definition of pharmacognosy. History, yeah, quite interesting. Now, everywhere people are using primary health system as well as the other conventional health system. People prefer the herbal products. Take an example of this COVID-19 time. People are appreciating to consume herbal products just to maintain their health, to develop their immune. So most of the immune boosters are from the herbal sources, and that we are practicing. Even ICMR has introduced some of the herbal related products. Ayush is introducing some of the herbal related products in this pandemic situation. So it is been recognized well in present era, where the generation of going at a molecular level and protein based drugs. Then how it has been originated, from where it has been originated. You can't imagine the lecture which I'm going to give you about the history of pharmacognosy, means the development stages of pharmacognosy, or I can say how many years back it has been originated. I'll be talking about the BC level. And afterwards you're supposed to know, okay, once this course knowledge has been gained by the student, where are it is applicable, where are you can be absorbed. That is also your opportunity. And how this subject can be penetrated into different sectors in industry, in research, in teaching, in marketing. So these are the different places this pharmacy role and its incorporation science is required. And how the development and newer lead molecules arrive and that we are consuming as a phytomedicines nowadays. These complete cyclization process or comes under the scope of pharmacognosy, and that will be a part 2 lecture. Maybe of tomorrow I'll post that. And the third topic is classification of crude drugs. It's a basic, uh, once you have studied about so many drugs, or if you see in the market, in the product, so many list of drugs will be there. But if you want to refer immediately in how to refer, in dictionary there may be a words given on the basis of alphabet, and the B, all the words will be there like that. On the basis of each letter, the words are mentioned in the dictionary. Same way, crude drugs are classified in the form of alphabetical. It can be classified in the form of taxonomical approach. It can be classified in the form of active principles present. It can be classified in the form of pertain to the activity. So these are the various ways to classify the crude drugs. The crude drugs means is a naturally obtaining material. It may be a part of the plant in the converting in the form of powder, and people do extract out of that for the product preparations, right? And the next topic is cultivation, collection, processing, and storage of crude drugs. So whether it's a method, asexual method of cultivation or sexual method of cultivation, or is a wild cultivation, what are the different process they involve for the collection, after collection, and the storage of crude drugs is very important. If the drug is not properly stored, it will not be stable. Each molecule, each constants present inside the material will play differently, and that may leads to the newer compounds. The newer unexpected formed compounds may be the lead for the side effects and the adverse effect of the uh, uh, product. So what are the various methods of storage conditions is required, why it is required. And for just an example, I don't take much time here. And if the moisture is present in the medicinal product or in the medicinal plant material of the medicinal plant material, this moisture will trigger the microbial growth that will contaminate the product. If any microorganisms absorb the contaminated product, maybe a chances of increasing the what we call enzymatic reactions in the plant material, that may leads to the another newer compounds. That those later substances and impurities will harm the health. And you also study about some cell wall constituents and cell inclusions. Cell wall constituents means in each plant cell wall, what are the other constituents are there? Like a chitin, lignin, depends upon nature of the plant, but this terminology may vary. Is helpful when you do for practical course. There, if when you go for staining with some reagents, sometime you may see a pink color, sometime you may be able to see the bluish color, sometime you may be able to see the purple color. For each story, reaction with that reagents what you used, it is due to the cell wall constituents. So for the identification and authentication purpose of the plant material, this concept is required. And of course, you are going to use a microscopy for internal characters and internal visualization of those plant material. And it may you also see in a powdered form also, it is in the scattered way about some characters of the plant materials. For an example, a drug of cinchona. Cinchona is a plant material. It's a bark portion. Bark means outer portion of the cambium. Cognostically, in the simplest language, outer portion of the stem. Okay. In that peeled one, if you just make a powder, and you can see n numbers of fibers. Those fibers are called as phloem fibers. It is a very lengthy one. Very lengthy one. You can see nicely when you stain with the fluoroglucinol with along with hydrochloric acid. Beautifully, you can see a very lengthy fiber, and that is a character you can use for the identification if other than cinchona, people adulterate it with some other bark material which is cheaper or which is not at all substitutions of this. When you see that microscopically, what you seen in earlier, that will not be there. I said a length is more. So if a length is more means how to measure the length. So there is a concept called as micrometry. So micrometry is can be done to measure either the length or the width or the diameter of the particle by using a eyepiece micrometer and the calibration with a stage micrometer of your microscope. That and all we'll discuss later. So this kind of experiment exposure is also there during your Pharm D program. And of course, study of natural pesticides already said. If you are not knowing about what is pesticide, what is synthetic pesticide, what is naturally available pesticides, you cannot correlate with the product which having the residual pesticides report. If any report comes to your hand, you cannot understand immediately. That's why they touch some basic about natural pesticides. Then they have given carbohydrates and related products. It means you need to know the definition of carbohydrates and the classification, chemistry and its properties. Some drugs or comes under this chapter. It's very simple. Maybe some of the drugs means some of the plant material belongs to gums, some material belongs to what you call bark, something belongs to the stem. So some plant material will comes into the picture of carbohydrate. For example, honey. I'll be talking about honey. It's rich of sugar, right? And that sugar means it's a carbohydrates. So gums are there. They are polysaccharide. They contain the polysaccharides. So I'll be talking about its sources, its origin, and its chemical constituencies and its uses. That's it. That only I'm going to talk, and how can we identify that substances. So I'll be teaching only one drug in this chapter. The remaining 10 drugs I'll be giving one to everyone, and they're supposed to prepare a presentation and they're supposed to share in our Google Classroom, or I may invite to present through Google Meet. Same way, another chapter called as lipids chapter, 12th and 13th pulled together I'm talking. In the lipid chapter, so many drugs are there, like you'll be studying about olive oil, castor oil, arachis oil, soybean oil, and shark liver oil, cod liver oil. These all oils that we are going to study. And the main aspects of those chapter is its biological source, family, chemical constituents, description of that, and uses, and some some adaptation aspects of that, and some standardization aspects also. So there are certain constant factors are there to check the quality. This all you are going to study under lipid chapter. There are around 12 drugs are there. I'll take one. Remaining thing I'll be giving as a seminar topic. And if you are talking about oil, you should know some basic about oils. This oil comes under the lipid chapter. So what is lipid? What is fixed oil? What is volatile oil? Apart from that, waxy material is there in the plant. Those also called as lipids. Some basic definition and some point of chemistry and some properties you're supposed to know before going into the detailed study of the oil containing drugs. And same way, a protein based drugs are there. Explanation is same what I given for the oil. That will be covered under the topic 14. And finally, plant fibers, natural fibers, plant material fibers are used for the surgical dressings and related products. So most of the cotton is used as a surgical product, right? And silk is used for the surgical product. And regenerated carbohydrate sources, carbohydrate sources, proteins also used in the surgical product. That will come to know when I was explaining this chapter. And finally, different methods of adulterations of crude drugs, how the crude drugs have been adulterated, what are the why they are adulterated, with some examples. I think Lynn's madam will be covering on Friday and coming Friday and Saturday. So intentionally people do adulteration, unintentionally happen the adulteration, and because of cost, because of non-availability, inferior with superior, right? Inferior quality with the superior, substandard, misbranded, so many things are there that will she will explain. So in a nutshell, all these topics will fresh up you the basics about, little basics about botany by means of microscopical experiment, and you come to know about growth drug and its history, and some cultivation aspects, and some drugs from three different area: carbohydrates, lipids, and proteins. Okay, with this brief introduction, let me go into the today's talk of the chapter 1. And again, before going into that, I'm sorry to come into the other basic touch. Some some definitions you're supposed to know. What is pharmacognosy? Pharmacognosy is of two words merged. Pharmakon means a drug. This word derived from Greek language. Gignosko, to acquire knowledge of. This word also comes from Greek. So, pharmakon means a drug. Gignosko means to acquire the knowledge. Acquiring the knowledge about drugs is called as pharmacognosy. And cognosco and cognosis, also another two letters, which is originated from Latin. It is the meaning is to know about what? Pharmakon, about a drug. So pharmacognosy, if anybody acquiring the knowledge or to know about the drug, naturally obtaining drug, it is not only the plant material, which includes marine, mineral, anything which is obtained naturally, which can use as a medicine. Okay. Who coined this term? This word was coined by a German scientist, C.A. Seidler, in 1815. In the year 1815, the word has been coined. Previously, it is called by different names: medicine, herbal, or maybe in the before civilization, what they called about it, we don't know. But it has been coined well by this fellow in 1815. Broadly defined as a scientific study of the structural, physical, chemical, and biological characters of crude drugs, along with their history, cultivation, collection, preparation for the market, which also includes knowledge about preservation. I used many times word crude drugs. What is crude drugs? It is used for those natural products such as plants or parts of plants, extracts and exudates, which are not a pure compound. It means part of the plant can be used as such, or the powder form of the plant can be used as such, or the gums which is obtained, that is exudates which is obtained from the plant, can be used, right? Opium is an exudate products of Papaver somniferum capsule. It containing a drug called as morphine, wonderful sedative drug. And people subject for process and get an extract. Those extract possess some medicinal value. But yeah, from the extract, if you isolate a single chemical entity, a defined chemical entity, defined compound, that is not a crude drug. That is a phytocompound. That comes under a different picture. It requires all clinical trials before releasing the product into the market. If you are using only the crude state of capsules and everything, you don't require the clinical trials. You require only the stability, quality, and efficacy studies. What is ethnobotany? It is a broad term referring to the study of plants by humans. What is ethnomedicine? It refers to the use of plants by humans as medicine. If human subjects study the subject of plants called as ethnobotany, the humans use the medicinal plants as a medicine called as ethnomedicine. Then what is traditional medicine? It is a sum total of all non-mainstream medical practices, usually excluding so-called Western medicine. Western medicines means allopathic system of medicines. If you exclude that, all other clusters, all other uh, practicing types or comes under uh, traditional medicine. For example, Ayurvedic system of medicine, Siddha system of medicine, Unani system of medicine, Homeopathy system of medicine. This all comes under traditional medicine. Now the market have using the word called as dietary supplement, nutraceuticals, food and complementary medicine, food medicines. These all are various terms has been derived, and it is selling in the product in a safer way. They don't require any clinical trials. They require only the safety profile. But physicians or the company cannot claim it cured this disease. It may be a supplementary or adjuvant for the existing therapy. That is a different phrase, that is a different phenomenon. I'm talking about Ayurveda, Siddha, Unani, and Homeopathy. This all streams comes under the traditional medicine. What is natural products? They can be entire organism. I said maybe a plant material or animal material or microorganism material. It may be a part of an organism, it may be a leaf or a flower of a plant, or it an isolated gland of an animal. Liver of shark fish gives a rich of vitamin A that you are witnessed. Soft gelatin capsules of shark liver oil, cod liver oil is available. So isolated gland of liver of shark fish we are studying, it is also natural product. An extract or an exudate of an organism. Exudate, I said, any secretory materials on this from the plant. They also call as natural product. Resins. Other example, gums, like latex. That in a rubber plant, what it comes out is a exudate material, right? So that also called as natural product. And of course, if you take a material of plant, if you take a plant material, you add a suitable solvent, maybe water or maybe some non-polar solvent, to extract the compounds, maybe like carbohydrates, proteins of primary metabolites, including with that some secondary metabolites. They are the active principles for the biological activity, alkaloids, glycosides. These all are class of compounds present in the plant material. So you are using a suitable solvent to extract out of that. That extract is also called as natural product. From that extract you are targeting, I want only the alkaloidal portion, and from that alkaloid I need only the indole group of alkaloid. In that indole group of alkaloid I require this from this plant, example reserpine, antihypertensive drug from the root called Rauwolfia. So Rauwolfia plant, then the root portion also called as natural product. From the root you taken the extract called as natural product. From there you are isolating a pure compound is called as reserpine. They also called as natural product. And that reserpine, if you are subjecting for medical treatment and it becomes a phyto compound, it requires a lot of clinical trials up to stage 4. Now coming to our core topic, that is the history of natural products in medicine. The history of herbal medicine is as old as human civilization. A great proportion of the natural products used as drugs by India, Greece, China, and Egypt, even before the Christian era comes. So the major contributions, the major knowledge have been disseminated from the country India, Greece, China, and Egypt before the Christian era. Means no European country contribution, no other Western developed country contributions. The study of drugs used by traditional healers is an important object of pharmacological research, because now also research is happening. During the COVID time, what our big officials are saying, find a medicine from the natural sources to eradicate this virus. And you might have heard hydroxychloroquine. This hydroxychloroquine is obtaining from the natural substances only, from the bark called as cinchona. It containing rich of the constants called as uh, quinine, is an alkaloid, and just one step process they convert into hydroxy quinine. That process now eradication of the viruses. So this all research happening with the basic touch knowledge of previously been practiced. Okay. And when it is originated, I'm going to talk about Sumerians and Akkadians, 3rd millennium BC. And even I didn't see 3 generations before relatives of mine. And I know my grandfather, maybe Unka Papa. Sumerians and Akkadians, they contributed a lot, but details are very less. But hypothetically, they say they coin that they may looks like this. In next slide, you can see that I have fetched from the Google search, but be not the same. Somewhat they looks like this. See, no synthetic material, even no pant shirt. All are naturally obtaining substances they use as a cloth material, and you see the surrounding all are herbs, all are herbs. It means they use natural methods to cure the disease. This is the proof they have as an image in the Google. And the Egyptians era started. Egyptians contributed a lot. In the terms of Eber's papyrus documentation by 1550 BC, they documented in the Eber's papyrus by the Egyptian people. By the picture itself, you can see what they are doing. They are doing some preparations from the based upon the natural substances. They documented well more than 800 different formulas and 700 different drugs information for pertaining to curing the diseases. So they documented almost 800 different methods of formula to prepare those medicines for ailments, to cure the ailments. So who did this? Egyptians did. Documented in the book. We can't call this book in the material. Those time no books and all. They used natural pigment as a ink, and they use some plant leaf as a material. Sometimes they use a sheath of outer covering of the plant as a material, a thin filament like material we can take from some plant. There they sculptured, there they are drawn, not by words also. So that knowledge, how it is transformed, that you will see in next slide. The Aryans of Indus Valley civilization has started writing the book, has written 3 treatises, 3 big treatises. So the knowledge of Akkadians and Sumerians and Egyptians, Hebrews is a document in the form of images, and these people, Aryans, after the Aryans and Indus Valley civilization time, a book was written, 3 books was written: Rig Veda, 2000 BC, Atharva Veda 1000 BC, and Ayurveda 100 to 600 BC. Even 100 to 600 BC before means approximately 6000 years back. Our concept is called Ayurveda. That's why we always believe Ayurveda is very, very old, ancient system of practice. By time immemorial, the drugs have been proven. So it was working. Now, due to this competition and other falsy manipulations in the product, it is not showing its potential. That is a different part. I don't want to talk now. And Ayurveda is a 6000 years back medicines. What is Ayurveda? Ayurveda meaning the science of life. Ayurveda meaning a science of life. It's about your body, outer body, inner body, your mindset. This all should work parallelly, then only your systems get rejuvenated. For that, the diagnosis method is completely different. It's not like that you went to meet a doctor for consulting for a fever. He write immediately, temperature is this 1 degree more, okay, take paracetamol. That's it. There it is not like that. They will see the cause factor. They will see where you live, what condition you live. They'll do the check of your stool test. Check the stools, the urine. See the biochemistry involved those days. And mindset, mental strength, everything they diagnose. Then, by these all etiological factors, physicians diagnose by means of Panchapudas. Panchapudas is nothing that you can see air, you can't see air, you can feel air, fire, heat, water you can see in the world, in the universe, right? Earth is there. So, air, water, earth, and others all comes under the Panchapudas. 5 elements are there in the universe. Same thing, it is there in your system also, in our system also. So if anything which is imbalanced between the universe and within you, there it triggers up or elevating the problem of any kind of three pitta, maybe vata, pitta, kapha. Not 3 types of pitta, it is called as dosha. Tridosha, vata, pitta, kapha. So it depends upon the human nature and behavior and inner disease that may vary and unequilibrated. So they find suitable herbal medicines or maybe a suitable natural product. Patient to patient doshas, considering the doshas condition, they prescribe the Ayurvedic medicines. Now, it is not really happening. Ayurvedic products are available, but those products meant for whom? Up to what extent? How much dose? The tailor-made protocol is not there. So those patties are called as classical Ayurvedic formulation. What we take as a capsule and syrup from Himalayan company. They are proprietary Ayurvedic formulation. Proprietary Ayurvedic formulation means one can incorporate by own formulas from the natural substances. So up to what extent it work? By the long study, by some clinical trials, they come and conclusion out of 190 has been cured. So okay, the drug can be approved. But there one-to-one cause, physician and a patient. Diagnosis, prescribing. The same medicines will not be given to Vata patient. The same medicines cannot be given to the Pitta patient. The medicines which is prescribed for Kapha will not be relevant to others. Okay, I don't want to go much after that, but it's quite interesting. If you go onto your website and listen some of the videos of Ayurveda systems. Then the ancient pharmacognosist called as Charaka Samhita, they coined a big encyclopedia of ISM, Indian System of Medicines, in 1000 BC, and almost it contains 2000 herbal remedies. They documented 2000 herbal remedies, 2000 detailed plant or natural product information for the various diseases. Then Shushruta Samhita, they have given the information about almost 760 plants, and they classified those plants in 7 different groups. So Shushruta Samhita contributed the knowledge about 760 plants in 7 groups. Now you might have heard about Hippocrates in 460 BC. He was working as a father of medicine. He also called as a father of medicines. What knowledge he was having is a tremendous. Those times there is no much literature or any knowledge acquiring systems. They started curing the patient with some, with the material available nearby or in the jungle. And he started doing the research and discovery process. I'll tell you one small example. If you look our ear, it looks like a kidney shape. The kidney shape in cognostical term called reniform. So if we see a plant part, either leaf or flower, in the kidney shape, he tried to do discovery. If we use this for the disease of ear, it works. It started working. And for the heart related issues, he was working with the leaf which or flower which looks like a cordate shape, heart shape, and he tried. Most of the time he succeeded. So morphological appearance of the natural products he used in a discovery process to treat those organs. That's why he is called as father of medicine. In most of the quiz, people ask, who is Hippocrates? Option A, B, C, father of medicine. And Dioscorides. Dioscorides era started, maybe not BC, after the death of Jesus Christ, 4080. He has wrote the book called as De Metria Medica, mentioned about 600 medicinal plants information. Along with the 600 medicinal plants information, he also written about some of the animal and mineral products. So Dioscorides contribution, 600 medicinal plants along with mineral and animal products details written in the book called De Metria Medica. Okay, this all documented, people have practiced, and the Islamic era has contributed a lot. Another 3 slides of Islamic era, I'll tell you. Ibn al-Tabari, but Google Assistant say it's not Ibn in al-Tabari. 770 and 850. They started the commodities. From one origin to the another origin, they taken the material by sharing the things. Those times there is no paisa or no rupees. So they give something and they give the medicinal product. So that has been interchanged from the community to community, place to place, and different locations. So their contribution is commodities. What type of commodities they did, what medicinal plants commodities they did, information you can go through the website, but it's not required. If you know some history of pharmacognosy is sufficient. And Ibn Sina, 1980 and 1037. The commodities has been remarkably noted, marked, and documented. So this really helped how much species, how much uh, abundance of drugs, in which location it is available. Okay, so people can come to know in which season, in which monsoon, where it grows also. So these all informations are being documented by Ibn Sina and Ibn al-Bitar, Ibn al-Bitar, 1148 and 1197. They are the people who made a law up to what extent we can do cultivation, up to what extent we can cultivate, to whom we can send which price, up to cost. This all kind of knowledges, rules and documentations been prepared by Ibn al-Bittar. What I explained for this slide, it was my understanding, but still they explain many things, but I didn't spend much time for listening those. But the concept is that they documented about the stocks availability and some rules they framed during that period. Then the era of European exploration started overseas. Not only the place to place and different location, those all medicinal information gone to the western side and European sides. It's all happened in 16th and 17th century. So the European system of practice of the natural product starts only 16th and 17th century. So their acceptance of the natural based products are very less when compared to Indian origin people and Greece origin people, Egyptian origin people. And there are also so many people contributed so many things. For an example, Leigh Murray, James Pettiware, Williams Withering, De Rossin, Serturner. These one scientist, I can say, they are come up with some kind of knowledge and it's been shared. I'll tell you one example. One of the fellow of this century, he brought a foxglove. It's called as digitalis. He discovered a plant called as foxglove, commonly called as digitalis lanata or digitalis purpurea, is a source of the drug. Now we call it as a digitalis purpurea lanata after the Linnaeus classification. And that fellow called as it's a foxglove. Wonderful medicines for arithmetic disorder. It acts as an anti-arithmetic drug. And same way, each contributions are good. That is given in the book called as Kokate, or you can check the online also. And the 18th century of pharmacognosy grown up like anything. What? Linnaeus, a person, a botanist, started naming the plant and classifying the plant. So you might have studied in a school time Linnaeus system of classification. So there it comes. At the end of 18th century, crude drugs were still being used as powders, simple extracts or tinctures. Till 18th century end, people used medicinal products in the form of powder, crude drugs or in the form of powder, or simply they extract with some using a water and just boil it, filter, they consumed. Or tincture, just they added a material, herbal material, add some alcohol and soak for some time. Constance goes into the solvent of alcohol and they filter and they consume. This was a practice till 18th century. The era of pure compounds in 1803, a new era is a history of medicine. The pure compounds which I am talking later in the 18th century, I mean the earlier of 18th century actually, but they mention the 18th century later. Isolation of morphine from opium by Stas and Atto. Stas and Atto are the persons. Method itself they given, the extraction method also given, Stas Atto method. In 1852, they isolated a compound called as morphine. It's a narcotic drug now, which is obtained from a plant Papaver somniferum, commonly called as opium. So opium is rich of constituents obtained from the Papaver somniferum. From that, people have isolated O as an atom, and that single entity has been proven. It's a compound called as morphine. Now also it is practicing. It's a sedative drug. And strychnine is a CNS stimulant phytocompound. In 1817, this research has been taken up. Quinine and caffeine isolation happened in 1820. Quinine, just now I said, hydroxychloroquine is a drug of choice now for eradicating the virus corona. And a caffeine, which is obtained from a tea leaf or a coffee arabica seed. There they isolated a pure compound caffeine. This all happened in 1820s, and that possesses CNS stimulant property. And nicotine from the tobacco leaf being isolated by Rainman and Posselt. See, people consumed as a raw material and powder form and some extract. Now the phytomedicine in the form of pure compound is there in the market, and what we are enjoying now, this all worked by the those guys in 19th starting century. So that's I'm saying the new era of history of medicine. And atropine is an anticholinergic drug in 1833, and cocaine in 1855. In the 19th century, the chemical structures of many of the isolated compounds were determined. Those guys in the end of 18th century, compound has been isolated. And in that isolated compound, how it looks structurally, how one can define that particular compound structurally. So for elucidating the structure and characterizing the structure, concepts and research all happen in the 19th century. I mean, the chemical structure of many of the isolated compounds were determined. I have proved in 19th century. In the 20th century, the discovery of important drugs from the animal kingdom, particularly hormones and vitamins. Apart from the plant material, a discovery process started. A research has started to discover new medicines from the animal sources, from the animal sources organs, and some vitamins, natural vitamins also been started doing discovery from the natural origins. This all happened in the 20th century. That we will see in the probably in the next lecture. The modern today's world practice, and I can say era of modern pharmacognosy. I can say antibiotic age. There are so many examples are there. I'll talk about that, and some scope about pharmacognosy and application of pharmacognosy in a part 2 lecture next week. I hope that you might have followed for last 40 minutes. Somewhere my voice may not be clear. Somewhere I struggled to convey some message. Kindly go through this presentation repeatedly. And finally, what I want to say is you have any sort of doubt in this, you can call upon my mobile and try to get the T-Sham book as earlier as possible through online, and be polite with all the teachers. And my humble request is that until unless teacher not asking you to comment or to reply as a WhatsApp message, please don't do, because it's hanging our mobiles, because we are not in on a single group, we are in a different class, in different groups are there. So you try to avoid unnecessarily a message in terms of thumb and other things. So thank you very much, and we meet you on tomorrow morning. Goodbye.